Hello everyone. Is everyone there? Are you there? Hello. Hi, Dr. Sarah.
Hi, Aya. How are you, dear?
I'm fine. Good to see you again.
Yes, it's great to see you, dear.
Okay, everyone, now with Dr. Sarah Shafiq. She's a lecturer of pediatric dentistry at Bani Suif University, and also she teaches pediatric dentistry as a lecturer at my beloved university, MIU. She's gonna please us now with a lecture about addressing white spots in pediatric dentistry, white spot lesions. And we are very glad and honored to have you with us today, Dr. Sarah.
Thank you, dear. Actually, the honor is mine.
Thank you.
First of all, I would like to thank all the team for the great organization. Also, I'd like to thank Dr. Hala Hazza for her kind invitation. So, thank you all.
Thank you so much.
Well, you're welcome, dear. Well, today I'm going to speak about one of the common problems that actually face us as pediatric dentists, which is the white spot lesions. Well, first of all, before dealing with it, I will start sharing my screen.
Yes, please.
Okay. Okay. Okay, let's go. Okay.
Great.
Okay, let's. So, as I said before, it's a very common problem that faces us as pediatric dentists, which is the white spot lesion. Before we start, to think what is the kind of treatment I'm going to use, I have to think about why I'm seeing this white spot lesion right now. Actually, developmental enamel defects or enamel discoloration has many reasons. Okay. First, it could be developmental, like the one Dr. George was speaking about before, or it could be acquired. Well, okay, I think, yes, that's it. Okay, it's either, as I said before, developmental or acquired. The developmental defects, they are like the ones due to trauma, infection, or molar incisor hypocalcification or amelogenesis imperfecta. And as we said before, they are very common. Or acquired due to dental decay as an initial caries lesion, or due to orthodontic treatment. So it's very common to see white spot lesion after removing the brackets for children. Usually we notice the white spot lesion. So this is a type of the acquired ones. So this is a systematic review that I really liked since I read it the first time. It was published in 2016. This systematic review says that there is no evidence that suggests that there is one way is better than another in dealing with those lesions. So all the treatment I'm going to speak about today, all of them actually are accepted and all of them could give you good results, okay? There is no one is better than the other, but it differs according to the situation that you are dealing with. Well, again, we have to differentiate between the hypocalcification and the initial carious lesion or the white spot lesion, okay? First of all, the hypocalcification, usually its place is incisal or in the middle third. As far as the initial carious lesion, usually see it in the cervical part. Add to this that the hypocalcification or the lesion due to a hypocalcification, it's always, not always, it's you're going to find it shiny when it's hydrated, okay? And when it's dehydrated, it's opaque. So why it's shiny when it's hydrated? This is due to the remineralization that occurred on the surface of this lesion. Okay, so this kid does not have, or he has a good oral hygiene. So remineralization occurred to this lesion after the eruption. So actually those children doesn't have a problem of oral hygiene. The second photo of the initial carious lesion, actually those kids have a problem due to the oral hygiene and the carbohydrate diet intake. So you're going to notice that the lesion is opaque all the way. if it's hydrated or dehydrated, and there is no remineralization that occurred on the surface actually. Actually, demineralization is occurring right now. So this is a huge difference between both. Again, something else we have to differentiate between the difference between fluorosis and MIH or molar incisor hypocalcification. Okay, first of all, the fluorosis, as you can see, it's a diffuse lesion. It's not demarcated one. It's symmetric, as you can see also that the right and the left centrals both having the same type of the lesion, and it's the defect here is in the enamel quality. As for the MIH, it's a very demarcated lesion. As you can see, we can see the boundaries of the lesion quite well. It's asymmetric, so it doesn't have to occur in both centrals the same like this photo. And again, it's enamel quality. So fluorosis and MIH both are having a problem with the enamel quality. Well, the difference between hypoplasia and hypocalcification, and this is very important because the hypoplasia, its treatment was discussed by Dr. George before me. The hypocalcification actually is a little bit more different. As you can see, sorry. As you can see in the photo, the hypoplasia, there is an actual enamel defect. The defect here was in the enamel matrix formation. So we do have an actual defect within the enamel. As for the MIH, it's only a hypocalcification. It's only the loss of the mineral content rather than the matrix of the enamel. So the matrix of the enamel here is normal, but the mineral content is not normal or less than normal. Okay, so which is harder to deal with? Is it harder to deal with the carious lesions, the white spot one that I'm going to talk about today, or the developmental defects? Honestly, the developmental defects are much worse to deal with. Why? Because the developmental defects, the sealing of the lesion is at the dentino-enamel junction, okay? So you might see at the surface a little spot, but actually the lesion at the dentino-enamel junction, actually it's very large. So if you try to go for remineralization or treatment, any surface treatment, you will not be sure that it's going to reach all the subsurface area. You're not going to be sure that it's going to reach the dentino-enamel junction. So we do have a triangle here where the base is towards the dentino-enamel junction and the apex is at the surface, which is totally different from the white spot lesion or the carious lesion, where the triangle here is the opposite, the other side. It usually starts in the enamel as an enamel lesion, okay? It usually starts in the enamel surface and ends at the dentino-enamel junction in a spot. So you can use any material that helps remineralization and you're going to notice an improvement in the color. So again, dealing with white spot lesions or the initial carious lesions is much more easier than dealing with the developmental defects of enamel. Well, when dealing with those lesions in children, actually we do have many challenges that face us. First, the cost of the treatment, and I have really to take this into consideration whenever I'm dealing with any child, if his parents is going to afford this type of treatment, yes or no. And this is a very important point that we usually skip, okay? We try to give the child the best we can, regardless of the cost, and actually this is not right. Second, being less invasive as much as possible, okay? Because we are dealing with the children. And here I'm talking about age category. We're talking about 7, 8, 9, 10, even 12 years old. I mean, this kid is going to need his tooth for the rest of his life. So please try to be minimally invasive as much as you can. Try not to remove from the tooth structure as much as you can, okay? Third is the fear of children, okay? No matter how old they are, actually, all of them, they do have the fear of the dentist. I mean, actually, we face this every day. So there are some treatments I'm going to discuss. Those treatments will take a long time. So with those fearful children, I do not recommend the ones that you're going to stay for a long time or long visits. Other treatments are going to be you're going to finish your treatment only in one visit. So with those fearful children, I think the one visit would be even better to them. Well, another question really pops up into our minds. Do I have to start dealing with the carious lesion, or do I have to deal with the white spot lesion of the child right now? Or do I have to delay it a little more? a little more. Something else, actually, regarding the time. If the child is going to go for orthodontic treatment, yes or no? Is it going to affect the treatment I'm going to choose? Actually, definitely is going to affect the treatment you're going to choose. Actually, whenever you see a white spot lesion for a kid, you have to start dealing with it. But if it was a developmental defect like the hypocalcification, sometimes you have to wait until the tooth is a little erupted more so that you can see the whole lesion. Sometimes the whole lesion you cannot see it clearly. So you can wait a little bit more till you see the boundaries of the whole lesion so you can deal with it. Okay, so here is the first step in the treatment of a white spot lesion in a minimally invasive way. Uh, First of all, as we all know that the modern concept in management of dental caries involves dealing with the dental caries as a disease rather than dealing with it as a lesion, okay? Dealing with the dental caries as a lesion, you will have to remove the dental decay and start using your dental restorations. And actually, definitely, this is not what I'm going to talk about, or this is not my issue today. I'm talking about, dealing with the caries as a disease is balancing the caries balance that you see right now, okay? How to deal with this caries balance? Increase the protective factors and decrease the pathologic factors, like increasing the salivary flow, for example, for the kid, like using xylitol chewing gums, give him a proper oral hygiene instructions, proper diet instructions. All of this will stop the decay. So this is the first step, or stop the demineralization. So this is the first step. If you are dealing with a white spot lesion, please try to make the child having a proper oral hygiene instructions and a proper diet, and definitely a good salivary flow. And if you're going to use any of the antibacterials, like chlorhexidine or something, would be even better to, again, stop the caries lesion and stop the demineralization. So, if the white spot lesion was due to orthodontic treatment, should I interfere once the child removed the bracket? Actually, the answer is definitely no. Because once the child removed the bracket, the lesion is called an active lesion. It might remineralize on its own with the saliva if the child is having a proper oral hygiene and proper carbohydrate diet intake. Yes, this could happen actually. So why to interfere in something that's going to resolve in its own? I mean, there's no point of this at all. Okay, so if you waited a little bit more for like 3 months or something after the removal of the brackets, and if you waited a little more and you still can see the white spot lesion, here you will have to interfere. Okay, here it's an arrested one. Here it's a lesion that will not go on its own. Okay, so you have to interfere using the techniques I'm going to talk about. So if you have a white spot lesion, please wait a little bit more. Okay, as I said before, it's 3 months is the time that you're going to wait for. So what are the techniques that we can use to deal with the white spot lesion or improve its color? It's either bleaching, microabrasion, remineralization, resin infiltration, attapulgite seal, or a combination therapy. And I mean by combination therapy that you can combine one or two, two or three even of the above mentioned procedure. Okay, here it comes. The research findings regarding the evidence of treatment of white spot lesion, actually it's very confusing because you're not going to find the best practice or the best thing to deal with those lesions. And as we know, everything has a learning curve to deal with. Well, something else I have to say before mentioning the line of treatment is the use of fluorides. If you're going to use fluorides with those kids, please don't start with it. So don't start with using topical fluoride varnishes. Why? We always knew that using fluorides with dental decay, it always helps remineralization. Actually, this is true, okay? But what fluorides does that it goes deep in the pores, actually in the superficial pores, and leaving the subsurface as it is. So actually, the surface of the lesion is going to remineralize, but the subsurface will stay as it is, giving the same white color. So the color is not going to be better, or it's not going to have a better aesthetics. Okay. Actually, I use the fluoride with young kids, and children with serious teeth. Actually, doesn't care a lot about the way those white spots in their anterior teeth. Okay, I can use fluoride on its own without any of the next treatments. The next treatments I'm going to talk about, actually, they are more for the permanent teeth, where in this age, kids become much more attentive to the way they look, the peer effect, how their friends see them. Actually, it's very important to them. And a white spot lesion actually could bother some kids, as you're going to see later on. Again, before we start the treatment, something else. This is the last thing I'm going to say before the mentioning the line of treatments. You have to set the parents' expectations. This is very important because, as I said before, there is no evidence that there is a material is superior than the other in the treatment, yes, of those lesions. But all of them will have an improvement in the color. So you can promise the parent that there will be an improvement in the color, but please do not promise them that the color will disappear totally. As I said before, there's no technique is superior than the other. No technique will guarantee 100% results for you. So you shouldn't tell the parents something like this. Well, those are the techniques. This is a table of comparison between the techniques. I will say this table by the end of my lecture. So the first technique is the HNMI paste. So why using this paste? Why the MI paste? Actually, it's a casein phospholipid with amorphous calcium phosphate. And as we know that amorphous calcium phosphate actually has lots of calcium and phosphorus content that actually help the remineralization. Add to this the presence of the casein phospholipid, which is the protein milk, the casein itself. It has an alkaline pH, and it helps to stabilize the calcium and phosphorus in this solution. So, if the child having a milk allergy, please do not use this technique or use this paste. Actually, milk allergy in children, it became very common nowadays. I don't know about you guys in your practice, but in my practice, I see this a lot. And again, it's the milk allergy, not the lactose intolerance. This product doesn't have lactose. It doesn't have any sugar, okay? But it has a protein milk. So, this is one of the best products that could be used for remineralization. When I started using the MI paste in my practice, I used to give it to the patients at home to use it, okay, to improve the color of the white spot lesion that occurred due to dental caries, okay. So actually, and this is the manufacturer instruction. After reading a little bit more, I started to see some other ways to use it in the clinic. So you can do it professionally, you can apply it professionally, and also give it to your patient at home to apply it, okay. This improves the color, yes. Well, this is my first case. This is a patient who's an 11-year-old kid. Her name is Lujain or Luji. Well, I started treating Luji since she was almost 4, I guess. Yes, I think when she was 4, she had a habit of keeping food inside her mouth for a long time. Luji could have her lunch for like 1.5, 2 hours or something. So that caused the decrease in her deciduous teeth. So I made crowns, pulpotomies, pulpectomies, composite restorations for her. Then when she was a little bit, and then I stopped seeing her. She traveled abroad with her parents, and then she came back to Egypt when she was around 11. And now her mama knows quite well that the white spots, they are the start of the dental decay. They are the initial sign for the dental decay. And when she saw her teeth like this, she brought the child to my practice, and I have seen this thing. She has white spot lesions all over her teeth. Okay, so how am I going to deal with her? She's too young. I don't want to remove those lesions and start using composites in such a young age. I started, as I said before, with the caries balance. I gave her proper oral hygiene instruction, decrease the carbohydrate intake, and let her swallow a little bit more fast, okay? So what you're going to use, and clinically, I use the etch and MI paste technique. So clinically, what you're going to need is the MI paste plus or plain. There are two types in the market. You're going to find the plain MI paste and the plus MI paste. The plus one is having fluoride like in the toothpaste. So if you're going to use the MI paste for a child who's less than 6, please use the plain one, not the one with fluoride. Okay, a Profi paste, Profi brush, orthophosphoric acid 37%, the one that you use for composite restorations, cheek retractor, cotton rolls, and a timer. Okay. So what are the steps? First, I started with polishing in order to remove the plaque and extrinsic stains and so on. Second, isolation and application of acid etch on the white lesion for 1 to 2 minutes. Actually, I applied it for 1 minute. Then I started the application of the MI paste for 3 minutes and tried to agitate it using a brush, using a polishing brush, not the one that you used for polishing, by the way, another clean one, okay? And start the application of the MI paste and then let it set for 5 minutes. Actually, we start with the etching in order to create more pores for the MI paste in order to incorporate more into the tooth structure. And the agitation also helps the incorporation of the MI paste inside the tooth. Well, some clinicians actually don't prefer the use of etch at all. They use the MI paste in their clinical practice. The same steps like here to apply the MI paste, to start to agitate it and let it set for 5 minutes without the etchant. Okay, also you can do this. This is also right. Well, then after the application of the MI paste in the clinic, I gave her some instructions like the brushing, the carbohydrate intake, and I gave her an MI paste with her at home in order to apply it before she goes to sleep, after brushing and before she goes to sleep, once per day. Okay, how many times do you have to do this for your patient? It's 4 to 6 times. An important thing that the child shouldn't or should avoid the dark colored drink or food. The drinks that or food that contains things like mustard, tea, coffee, chocolate, soda, and so on. Okay, so I'm sorry. The case on the top is it's not mine. It's for Dr. Jeanette McLean Budd, and as you can see, she used here the MI paste, the same technique that I used. And the one in the bottom actually is mine. This is Luigi's case. You're going to find that lateral. It looks much better. The lateral on the other side, the canine, the lower lateral too. So as you can see, there is an improvement, but actually the white spot lesion, they did not disappear completely. Actually, this is after 4 times of the application of the MI paste and after 1 month of having the MI paste with her at home. Okay. Actually, I didn't have the chance to see her later on due to the coronavirus thing and the total lockdown for everything. So up to the moment, I didn't see her, but I gave her with her the MI paste at home to use it during this period. Well, the price of each item I used, the first item, the MI paste, actually in the Egyptian market, it costs around 250 bucks. Sorry, 250 LE or Egyptian pound. And as for the acid etch, it's for the best one, it's going to be less than 50 LE or 50 Egyptian pounds. So and we do all have the acid etch in our price. So as you can see, it's not something costly. It allows the remineralization of the tooth structure. Again, you can use it with the white spot lesions or the initial decay, and you will have an improvement in the color for sure. I think I had a question about someone is talking about how the MI paste goes for remineralization. I said before that it has a casein phosphopeptide and amorphous calcium phosphate. Amorphous calcium phosphate has lots of calcium and phosphorus ions actually. When the concentration of calcium and phosphorus is very high in the mouth and it's very low in the tooth, it works by the difference in the concentration. The tooth will uptake the calcium and phosphorus that's in the saliva or that's in the outer environment. Okay. After this, it has the casein or the protein milk with a very high pH, so it neutralizes the acids of the bacteria. Well, Second technique is the etch, bleach, and seal. Actually, it's not a very, I definitely don't mean this cute seal. I mean another seal. Okay. Um, Actually, this technique is not used a lot because it's a little bit old one, but I had to use it with this case because I really was out of everything. This child, she's a 12-year-old kid who presented to Moscow International University. Um, Actually, our resident, Dina Komi, is the one who saw the girl in the diagnosis. Actually, this girl, she had badly decayed sixes that needed endodontic treatment. And all that was concerning her is the anterior teeth, okay? And the way she looks. She came like in August, and the schools started in September. And she said that she has been bullied and teased at school, and she doesn't want to start a new year in this way. So I was trying to find a solution for this girl. The first thing I thought about is I'm going to bleach those dark spots and use icon for the developmental defect. Actually, this is a developmental defect. I'm going to use icon. Okay. I started searching in the clinic for the icon. Actually, I didn't find icon. I started to use it to search for anything to be used for bleaching and to find any bleaching agent because we were at the end of the year where the intern or the internship year, so most of the materials were out of most of the materials actually, so I only found the basic things. Okay, so I wasn't able to help the girl. I told Dina we're going to give her an appointment within 2 months or something after we have the new stuff. Well, the girl started to cry. She said, so I will not be able to go to school. Well, me and Dina, we did our search and we tried to find a solution for this girl. We gave her an appointment the week after, and we used this technique, the etch, bleach, and seal. This is what we found that could be suitable for her. So what you're going to use with this technique is the polishing paste, the cheek retractor, the acid etch. Well, this cup has sodium hypochlorite in it, or the Clorox, as you've seen in the previous slide, light cure, and an adhesive. Okay. So first of all, I start with polishing in order to remove the extrinsic stains and plaque, as we said before. Second step is applying the acid etch for 1 to 2 minutes, and here I applied it for 60 seconds actually, or 1 minute with this girl. Then I started applying the sodium hypochlorite using a microbrush. Okay, I used the microbrush. I started to agitate the sodium hypochlorite for 5 minutes. Actually, the sodium hypochlorite here, it acted as the bleaching agent. So the acid etch was to create pores in order for the sodium hypochlorite to go inside the enamel pores in order to clean those stains. Okay, then I apply the adhesive, and here I use the total etch one. You don't have to use a self-etch adhesive one, or you can use a clear sealant. Actually, a clear sealant, I guess it would be better, or I think it's actually better using a clear sealant, but again, I didn't find any sealants because, as I said before, it was the end of the internship year, and I really wanted to help this girl. So I applied the adhesive and start curing adhesive for 20 seconds, as we all know. I gave her some instructions like brushing and flossing, as we all do, and again to avoid the dark drinks for the first 24 hours. So this is the end results. Actually, it's not the best thing, but the girl actually she left the clinic happy. She was happy with the results. I know those results actually could have been much better if I used something like Icon, but actually I didn't have any. So if you're practicing or if the child parents cannot afford to pay for something like the Icon, you can use the technique I am talking about, which is the etch, bleach, and seal. Clorox for 1 liter, it's only 10 LE or 10 pounds, so I think it's even less than 10 pounds. So, I mean, you can use it with anyone. As for the adhesive, it's a little bit more expensive, but you use the adhesive everywhere in composite restorations, for example. I mean, you use it daily. So, this technique, it's very cheap. It did not cost anything, and actually the girl left happy. The third technique, actually, it's the most expensive of them all. You can use it with white spot lesion or the initial carious lesion, and also you can use it in the developmental enamel defects, the hypocalcification ones. Actually, they give the best results with the hypocalcification. The resin infiltrate the MI paste or the etch and MI paste technique will not give good results with the hypocalcified lesions. Actually, I will not notice improvement in the color. Okay, as I noticed in my case, because my case it was an initial carious lesion. So resin infiltration could be used with the hypocalcification and also in the initial carious lesions. So the rationale behind its use that its resin actually has a very high infiltration coefficient. It reaches 273 centimeter per second. And that of the adhesive that I used with the previous case was 31 centimeter per second. So can you notice the difference? Actually, it infiltrates deep into the enamel. I'm sorry. So this is a very very good choice, but again, its cost is too high. Well, this paper was published in the Careers Research in 2007, but actually I really like the electron microscope photos because they show how much the hydrochloric acid can infiltrate or can remove from the enamel, so that whatever you're going to place is going to go deeper. Okay, and with the resin infiltration, we don't use the regular acid etch. Actually, there an etchant is provided with it, and it's hydrochloric acid, and use it for 2 minutes. As can you see how many layers of the enamel were removed. When compared with etching with orthophosphoric acid, the 37% that we regularly use with the composite, as you can see, it did not remove a lot from the enamel surface. So this helps more infiltration of the resin. So what you're going to need, if you're going to use the third technique, which is the resin infiltration, you're going to use the Icon Smooth Kit. Okay, it's provided in the Smooth Kit and Proximal Kit. Here we're talking about smooth surface carry, so we're going to use the Smooth Surface Kit. Isolation of your choice, but please do not use the thermoplastic ones or the available rubber dams in the market. It's either to use its own dam, its mini dam provided by the same company that provides the Icon, or you can go for a cotton roll isolation. Okay, definitely you're going to need a timer. Again, Profi paste and polishing brush, high and low speed contra hand paste, cotton rolls, floss, micro brushes, light cure, finishing burrs, and definitely a camera to take a pre and post operative photos. Well, first, you're going to go for polishing. Okay, then yes, to clean with Profi paste. Then apply the Icon Etch. Here we apply the Icon Etch for 2 minutes, the hydrochloric acid for 2 minutes, and please do not apply it exactly on the lesions. Try to go a little bit more, like for 2 millimeters or something outside your lesion. Well, there's a little tip. Either you can use the applicator provided with the acid etch or the Icon etch, but as you can see, the applicator is a little bit white, so actually you're going to lose a lot of the material, and this material is literally expensive. Or you can use it with a micro brush, and I'd go with the micro brush, which is really much better. You're going to waste less material. Okay, so we applied the our etch for 2 millimeters, or sorry, 2 minutes. Then okay, then start rinsing. The second step, you're going to use the Icon Dry. There is a tube provided by the manufacturer called the Icon Dry. What is the Icon Dry? It's an ethanol. It's a 99% alcohol. Okay, so what is the function of ethanol here? So actually, alcohol is having less weight, okay, than water. Actually, water is heavier than ethanol. So what's going to happen that ethanol is going to replace water, okay, and then when using the tip of your airway syringe to dry the surface, ethanol is going to be volatile and really evaporate. So you're going to have your pores empty from water due to the use of the Icon Dry. Okay, then start applying your alcohol. After starting applying your alcohol, you're going to notice that the lesion will disappear. Okay, so if the lesion did not disappear, please go to step number 1 again, go for etching again for the second time. Then apply, then rinse and dry, and then apply the alcohol, and then start seeing your lesion again. If the lesion disappeared, then okay, go ahead and go for the next step. If the lesion did not disappear, you can go for etching for the third time, okay? After third time, etching doesn't have, it's useless, okay? So it doesn't have any meaning actually doing this after fourth time, okay? If third time and you still can see your lesion after applying the alcohol, so here you're going to do something else. You will have to remove from the surface layer, either using a stone, using some plastic, whatever you like. Actually, I use a stone. Again, after applying the alcohol, if the lesion disappears, now you are ready to apply, then dry. Yes, then dry using the tip of the airway, syringe, and now you will be ready to apply your infiltration, your resin infiltration. Apply the resin infiltration for 3 minutes, then wait a little bit. Do not cure at this time because the resin actually move inside the enamel by the capillary action. So just wait for 3 minutes. You may need to reapply it once again over after 3 minutes. So after applying it, then light cure it for 40 seconds. But please, you have to remove the excess first. Remember to remove the excess using cotton rolls, as in the photo. Then cure it, then finish it and polish it as much as you need it. Well, this is the kits available. The one with the shield, this is for the proximal decay, and the one without the shield is for the smooth surface. Actually, it's supplied in a 2-patient kit and a 7-patient kit. The 2-patient kit is enough for 6 to 8 white spot lesions, and the 7 actually it's much more than this. But the small kit or the 2-patient kit actually it costs around $130. So this is a little bit high price for this. So but again, you will get almost the best results using the resin. Not almost, actually, it's the best one for the white spot lesions. Okay, so here's the pros and cons of each treatment. As for the HMI paste, actually it remineralizes the tooth structure. You did not put any resin, you did not close the pores by any material. Actually, remineralization had occurred. It's the least invasive one, okay? It's so easy to be applied. Good for patients with more time and less money. And as for its disadvantages, actually it needs patient cooperation more. It's not going to work on lesions like hypocalcified ones or the developmental defects. It's time consuming, and if your patient is a mouth breather, you will not going to find much progress in this case. The icon, or as I said before, the resin infiltration, you're going to remove the white spot only in 1 appointment. No compliance is needed. Okay, superior aesthetics, actually it's the best one. And again, or I think I didn't mention this, that the refractive index of ICANN actually is very close to the tooth structure. I guess, yes, the enamel is 1.6, and as for the ICANN, it's 1.46. So actually, you will get superior aesthetics. And it's stable, less invasive. You're not going to use a microabrasion or anything of these. And it arrests the insidious caries lesion. The main disadvantage is that it's a very costly material, does not work also in all lesions. Sometimes actually it does not work. In a very stubborn lesions, it does not work. And it blocks the natural remineralization. While the extraplatinum seal, it's very inexpensive. I mean, it's not costly at all. Anyone can do it in their practice. 1 appointment, no compliance. It's good with the pronounced staining, but it will not work in every lesion. Does not have superior aesthetics like the ICANN, and it blocks the natural remineralization. So you can use a combination of those techniques. Yes, for example, the case I told you, Luigi, the first kid who had initial caries lesion, she had a dark spot on the canine. I applied sodium hypochlorite on it. And again, I'm planning to use Icon with this girl. because she's going to go, if you know, she had a highly positioned canines, so I'm going to refer her to an orthodontist. So in this case, I'm going to use Icon as it makes better bond with the brackets she's going to place. Well, all children actually deserve to smile. All children deserve to be happy, and we have to find solutions to all children on Earth. Whatever their the social standard or the financial standard of their parents were, whatever racial differences. I mean, children are children everywhere, and they deserve to smile. Well, thank you. I hope this lecture was beneficial. I was really happy being with you today. Any questions?
Thank you so much, Dr. Sarah. I really, really enjoyed it. Your lecture. I was like smiling all the time. I have to put off my camera every once in a while because I was so happy with the topic. It's very important as well because many dentists are not aware of the treatment of the hypocalcified lesions, especially the molar inside mineralization. So thank you so much for addressing this really important topic and how to manage it. Everyone, please concentrate. I hope you concentrated in this lecture. It's very, very useful. I hope you all enjoyed it. So if anyone has any question for Dr. Sarah in the chat box.
Is
MI paste only pediatric use?
No, it's also used for people having sensitivity. Tooth sensitivity, you can use it. So it's for everyone. I mean, it's it's very beneficial to use it after bleaching. Also, some days use it after bleaching case to help remineralization. So I think this is one of the best products in the market, in my point of view.
Yeah, I love it. It's amazing.
Yes.
Like a magical paste.
Yes.
Okay, everyone. If was deep white spot lesion, what to do? Deep white spot is another question. I think we have a problem. Dr. Sarah, are you with us? No, I think we have a technical problem in the connection. Dr. Sarah? I believe there was a problem, okay, in the connection. So I would like to thank Dr. Sarah a lot for the very useful information she shared with us today. And thank you again, and hope to see you, inshallah, soon in the coming events in our university, soon, inshallah. So everyone, don't go anywhere. We have a next lecture for Dr.